Let's talk about symptoms of histidine deficiency. Some of the core ones, and these are in humans, right? So anemia, especially anemia that's non-treatment responsive, meaning you're taking iron to correct the anemia and it's not working. You need histidine to help shuttle and bind iron to make hemoglobin. So if you have a non-responsive, non-treatment responsive anemia, you might consider looking and asking your doctor to measure your histidine levels. Now, one of the other non-responsive anemia issues happens with gluten, just as a side note. So gluten can cause gluten damages the stomach lining, leading to iron malabsorption. So even though you may be being treated with iron, you're not absorbing it properly. That's just another type of iron, of iron anemia that's resisting treatment. We also know that symptoms in humans are neurological problems. We'll get into some of the human research here shortly. We know that in kids, inadequate histidine can lead to stunted growth. We know it can cause cognitive issues as well as frequent infections because of its role in your immune system. We know that because of its buffering role with pH, it can lead to muscular fatigue and weakness. As well, we know it can contribute to hearing loss, and that has to do with neurological mechanisms and histidine's function. Okay, let's look at some of the research here. So this study, really good study on so you can see here the predicted effects of histidine administration. We know that histidine has antioxidant properties, anti-inflammatory properties, protein buffering power, a metal ion chelator, protection against glycation, which is against high blood sugar, as well as oxidation of fats in the bloodstream. We know that histidine improves erythropoiesis. What does that mean? That means this is red blood cell production. So it helps your body make red blood cells, which are critical in carrying oxygen to your tissue. We know it can reduce fatigue, increase filaggrin, that's that skin protein that helps protect your skin. And then we know it can increase THF, that's folate, okay? This is tetrahydrofolate, so this is vitamin B9. This is what we were talking about a moment ago. The byproduct of the breakdown of histidine leads to improvements in methylation of vitamin B9. So potential benefits, high intensity exercise. So those of you that are exercising aggressively, you might want to have your histidine levels checked if you're struggling. Age-related disorders, those of you struggling cognitively or neurologically. Those of you with cataracts might want to consider having your histidine levels checked. Obesity and metabolic syndrome, we know it can have impacts on the inflammatory cascade. There have been human studies on histidine being effective in patients with rheumatoid arthritis. We know there's implication here for inflammatory bowel disease. I'll talk about why in just a minute. Cardiac surgery and organ preservation, as we mentioned, you need histidine to regulate calcium in your heart muscle. Malignancy, and this is not necessarily, those of you with cancer that maybe are taking methotrexate, what they've found is that histidine helps methotrexate work better. So not that I'm a fan of that particular medication or the traditional methods of how cancer is being treated, but again, it's information for those of you who are maybe taking that medication. We know, we can keep in mind that methotrexate blocks. This is interesting, right? A lot of overlap here, but blocks vitamin B9. It actually causes a vitamin B9 deficiency. We know histidine helps methylate B9, but we know that methotrexate can block it, but histidine helps methotrexate work better. We know that histidine deficiency can lead to skin inflammation and then again anemia of uremic patients as well. So let's look at a few more things here. We said that it would help to kind of help mitigate inflammatory bowel disease, and so I want to show you what some researchers found with histidine as a mechanism to fight against Candida. So if you've not heard of Candida, Candida is a type of yeast that inhabits human GI tracts, but when you get Candida that grows too strongly or you get an overgrowth, in essence, if that goes up, as yeast, what does it do? It ferments carbohydrates, and when it ferments carbs, it produces alcohol that can damage your gut, it produces alcohol that can damage your liver, and but it also produces fungal toxins that can damage your mucosal barrier. And so what these researchers were trying to understand is what was the benefit? How did histidine, what was the mechanism of how histidine helped to reduce Candida from becoming problematic? You see, so what they found is it has antimicrobial properties. There's a histidine-rich glycoprotein, which you see here, HRG, histidine-rich glycoprotein. HRG bound to Candida cells and induced breaks in the cell walls of the organism. So that histidine-rich protein basically pulled apart or broke apart the membrane, the cell membrane around Candida cells, killing them, making it harder for them to thrive and survive. You see correspondingly HRG preferentially lysed ergosterol. This is the cholesterol equivalent for yeast. Yeast use ergosterol as a major source of fat. Humans use cholesterol, but you can see it lysed it, or it cut ergosterol, making it less available for yeast to have. HRG, okay, so you can see here both antifungal and membrane rupturing activities of HRG were enhanced at low pH and mapped to the histidine-rich region of the protein. So at any rate, this study was carried out in mice. We can't, sometimes we can't just directly translate animal studies to human studies, but I think it's a very interesting finding. And a lot of times we do see that what happens in animals also happens in humans once the research is performed. But I would just say, if you are having trouble with, ladies, if you're having trouble with chronic Candida overgrowth or vaginal yeast infections or those types of problems, and nothing's working, you might just ask your doctor to measure your histidine. You see in this study, anti-inflammatory and anti-secretory potential of histidine. This is another mouse study, but this was against salmonella. So here I was telling you earlier about inflammatory bowel disease and histidine having potential benefit. Again, you can have inflammatory bowel disease caused by Candida. You can also have inflammatory bowel disease problems caused by bacteria like salmonella. So you see here in this mouse study, histidine, a known antioxidant, reduced the amount of fluid accumulating in the intestinal lumen and protected the intestinal tissue from the damage of salmonella. And further evidence favoring this mechanism included the capacity of L-histidine to scavenge reactive oxygen species produced as a result of LPS. What is LPS? So when you have these bad bacteria, one of the things they produce is something called an endotoxin. And one of the primary endotoxins is called LPS, lipopolysaccharides. And these guys can cause microscopic damage to the gut wall, to the gut lining, creating leakiness, right? So leaky gut, and that can create a cascade, a whole host of different problems, because once you have LPS damaging the gut, they can now leak into your portal circulation, which goes straight to your liver, and these have now been linked to fatty liver disease and liver damage, as well as systemic inflammation. So just because you have bacteria or bug in your gut doesn't mean it can't translate across into the system, to your blood, creating system-wide inflammatory process. So again, this study, histidine was effective at reducing the damage caused by these endotoxins produced by bacteria, and the LPS endotoxin. So the potential therapeutic value of anti-inflammatory drugs containing an L-histidine-like structure could protect infected mucosal tissues irrespective of the etiology or the source of the microorganism. So animal studies give us great insight. Those are animal studies. Okay, let's move on to human. So human studies have shown histidine benefits the following: metabolic syndrome, obesity, chronic inflammation, poor stomach acid production, mental fatigue, cognitive issues, dialysis patients benefit, and patients with dermatitis, atopic dermatitis benefit. Let's break that down and show you some of the research on this. And more than that, like this first study is on COPD. So this was a trial done, published in International Journal of Chronic Obstructive Pulmonary Disease. In our COPD cohort, meaning this is chronic obstructive pulmonary disease, okay, so this is asthma, bronchitis, etc. serum histidine was reduced with an associated increase in histamine and basophils, which means more mast cells and more histamine production. Histidine is known to be inversely associated with inflammation and oxidative stress in patients with metabolic syndrome and chronic kidney disease. In fact, histidine supplementation has been shown to suppress inflammatory processes. We found the same relationship in our cohort as histidine was negatively correlated with interleukin-6 and TNF-alpha. What are those? Those are chemicals that scientists and doctors use to measure inflammation. So when these are high, they're markers for inflammation. So implying the possibility that lower histidine concentrations may contribute to pro-inflammatory state in patients with COPD. So there you have it. There's lung inflammation in histidine. Here's another study on histidine levels as indicators, as predictive indicators of disease activity in a condition called Takayasu arthritis. Now, this is an autoimmune inflammation of the arteries, and it can be very, very problematic for people suffering with it. So histidine levels were significantly decreased in active Takayasu arthritis patients. The conclusion of this study demonstrated that altered circulatory histidine levels in TA patients that may serve as a surrogate marker for improving the diagnostic screening of active and inactive patients. So they're actually studying histidine because it's known to reduce inflammatory chemicals like interleukin-6 and TNF-alpha as an indicator for the therapeutic situation around people with that disease, whether their disease is active or not. In this one, rheumatoid arthritis was treated with L-histidine. This was a double-blind, randomized, placebo-controlled trial. And so you can see what they were using was L-histidine to treat patients, and they were using 4.5 grams per day, or they were using placebo. And they did this for 30 weeks. And what did they find? They found a decrease in rheumatoid factor. So rheumatoid factor, RF, is the primary lab marker for rheumatoid arthritis. And so they found a reduction in that lab marker in patients supplementing with histidine. There was also suggestive evidence of a beneficial effect of histidine in patients with more active and more prolonged disease. So I'd love to see follow-up research being done on this, because one of the problems, as we know, with nutritional research is it's hard to fund, it's hard to get funding, because you can't patent L-histidine. L-histidine is an amino acid. It's God's work, and there's no way to patent it. So there's not a lot of money. There's not a lot of money scientifically being thrown at nutrition as an investigatory for disease outcomes. And so we have limited studies as a result of the lack of financial incentive. Now here's another study. You can see histidine supplementation improves insulin resistance through suppressed inflammation in overweight or obese women with metabolic syndrome. And so this was a randomized controlled trial where they, it was also double-blinded, where they gave 4 grams a day of histidine. So you can see here 4 grams a day. The N was 50, so this was 50 patients were being studied. Or they gave an identical placebo, and this was for 12 weeks. So 4 grams a day for 12 weeks. And here's what they found. Histidine supplementation significantly decreased something called HOMA-IR, which is a measure of insulin resistance. So it improved these patients' insulin response. We know that it lowered their waist circumference, on average of 2.86 centimeters. We know that it lowered fat mass by 2.71 kilograms. We know it reduced serum inflammatory cytokines TNF-alpha by almost 4 points. We know it reduced oxidative stress as measured through superoxide dismutase and glutathione peroxidase by almost 18 and almost 14 points, respectively. The conclusion: histidine supplementation could improve insulin resistance, reduce BMI, body mass index, reduce fat mass, and non-esterified fatty acids, NEFA, that's what that stands for, and could suppress inflammation and oxidative stress in obese women. So fantastic outcomes. I mean, this is drug-like impact, right? So with a nutrient, with just simply adequate diet, possibly, but also supplementation. 4 grams of histidine led to this effect. So here's another study in humans on cognitive performance in subjects with high fatigue and sleep disruption scores. And so they gave 1.65 grams a day to these patients. And this was a double-blind placebo-controlled trial as well as 20 subjects with high fatigue and sleep problems. And the results suggest that daily ingestion of histidine may ameliorate feelings of fatigue, increase performance during working memory tasks, and improve the clear thinking and attentiveness of these patients. So cognitive performance enhancement. Here's another study. You can see in kidney disease patients, plasma histidine concentrations were significantly lower in patients with chronic kidney disease. Plasma histidine was negatively associated with age, C-reactive protein, interleukin-6, leukocytes, thrombocytes, fibrinogen, hepatocyte, growth factor, as well as adhesion molecules, insulin-like growth factor, and 8-hydroxy-2-deoxyguanosine. What does all that mean? That means that basically low histidine was linked to worsening of all these other things. And so all these markers here are markers of inflammation or markers of metabolic chronicity. 8-hydroxy-2-deoxyguanosine is a metabolic byproduct of DNA damage. And so it's saying that low histidine increased the amount of this chemical that they were finding in patients. It also was associated with poor hand grip strength, lower hemoglobin, and lower albumin. And yet again, we've talked about the hemoglobin aspect. Albumin is a serum protein that's important for delivery and carriage of nutrients through the bloodstream. We also know it was associated with all-cause mortality. So low histidine increased risk of death, basically. Low plasma concentrations of histidine are associated with protein energy wasting, inflammation, oxidative stress, and greater mortality in chronic kidney disease patients. So how many of you with chronic kidney disease have ever had your doctor measure your histidine? Chime in the comments. I bet the answer is 0. We test histidine on everyone that walks through the door. I probably see histidine deficiency in anywhere from 10 to 15% of the people that we measure it in. So it's not an uncommon deficiency. Protective role of histidine supplements against oxidative stress, damage in the management of anemia and chronic kidney disease. So another kidney disease study, you can see histidine is essential in globin synthesis and erythropoiesis, which is red blood cell formation. It's been implicated in the enhancement of iron absorption from human diets, so it aids iron absorption. Studies have found that L-histidine exhibit antioxidant capabilities such as scavenging free radicals and chelating divalent metal ions, hence the advocacy for its use in improving oxidative stress in chronic kidney disease. Okay, we talked about this a few times, but this was actually, again, human study. So this was a randomized, double-blind, placebo-controlled crossover nutritional supplementation pilot study where they were giving histidine in adult atopic dermatitis patients. There's 24 people in this study. And you can see once daily oral histidine significantly reduced atopic dermatitis disease severity by 34%. That's more than a third reduction using a physician assessment scoring tool. And so we have, I mean, that's quite significant when you consider that it's an amino acid that is a low cost to humans and a low side effect profile, virtually at these doses, a no side effect profile. And so this was just a 4-week study. And you can see 39% patient self-assessment using the patient-oriented eczema measure tool. So they used 2 different types of measuring tools. One of them was a 34% increase, the other almost a 40% improvement. Summary, the clinical effect of oral L-histidine in atopic dermatitis was similar to that of mid-potency topical corticosteroids. Think about that for a minute. That's a very powerful statement. Taking L-histidine, this simple amino acid, was as effective as corticosteroid use. Now, why is that such an important takeaway? Because if you're stuck on corticosteroids, if you're using topical application of this class of medication over long periods of time, one of the common side effects is increases in blood sugar, increases in blood pressure. We know that corticosteroids reduce vitamin C, which is critical for maintaining skin integrity. So over time, the longer you're on it, the worse potential for your skin because you're blocking and inhibiting vitamin C. We know they reduce vitamin D, which is important for inflammation. We know corticosteroids affect calcium, lower it, and they reduce magnesium, and they reduce zinc. So we don't want all these side effects. These are horrible nutritional side effects. We also know that long-term corticosteroid use can cause scalding skin syndrome because you actually become addicted to the corticosteroid. If you quit using it, your skin dramatically worsens and creates a scalding skin-like reaction. If you look through some of my older videos, I had years ago a patient testimonial where is a woman that was basically being overprescribed corticosteroids for years and years and years to treat her polymyalgia, which is a form of muscular autoimmune disease, and it ended up causing severe facial outbreaks and rashes, and she ended up developing this problem right here as a result of chronic corticosteroid use, and it took us more than 12 months really to get it under control. But you know, part of how we did that was diet change and nutrition supplementation and nutritional testing. But bottom line is this study for atopic dermatitis shows that histidine was equally effective as mid-potency topical corticosteroids, and combined with its safety profile suggests that it may be a safe non-steroidal approach suitable for long-term use in skin conditions that are associated with filaggrin deficits. Remember, filaggrin's that protein that histidine helps to produce. Now, here's another report here on histidine supplementation in adults and children with atopic dermatitis. The inflammatory skin condition is prevalent in 20% of young children. That's a lot. There's an unmet clinical need. We have definitely an unmet clinical need. Kids being pumped full of steroids is not winning this war, but unmet clinical need. What do we do with these kids? They're 20% are having inflammatory skin conditions. So unmet clinical need for safe interventions that target the etiology of the disease. Deficiencies in the skin barrier protein filaggrin have been identified as major predisposing factors in atopic disease in mammals. L-histidine is rapidly incorporated into epidermal filaggrin, and subsequent filaggrin proteolysis releases L-histidine as an important natural moisturizing factor. Again, moisturizing that skin that's drying out and inflamed. It has therefore been hypothesized that L-histidine supplementation will be a safe approach to augment both filaggrin and NMF, the moisturizing factor, and enhance skin barrier function and reduce the severity of atopic dermatitis. In this clinical pilot study, adult subjects who took a placebo or they were using 4 grams of L-histidine daily, this was an 8-week study, L-histidine reduced the symptoms by 34%. Tremendous outcome. You see another one here in 98 adults, 4 grams of L-histidine daily reiterated a lack of causal AEs, skin inflammation, and also reported 33% reduction in topical corticosteroid use. And another one, a placebo-controlled clinical pilot study conducted in young children with atopic dermatitis, taking 0.8 grams. So these were 3.5-year-old kids. So if you've got a kid, small kid, 0.8 grams of L-histidine a day, showed that eczema area and severity index scores were reduced by almost 50%, 49% reduction. These studies indicate that the levels reported oral L-histidine supplementation is well tolerated and has potential as a safe intervention for long-term use in the management of atopic dermatitis. Now, those of you who've listened to me for any length of time know I'm not about managing. I don't want people to have to manage their condition. Whether you're managing it with a corticosteroid or you're managing it with histidine, I'd rather you manage it with histidine if it's working for you. because there's no side effect profile from that, unlike the side effects of a corticosteroid. But at the end of the day, you also want to know what is driving the skin inflammation in the first place. And so I know this isn't a show about gluten, but those of you watching to learn about histidine should know that the vast majority of skin inflammation of unknown origin responds extremely well to gluten-free diets. And so if you have not entertained this, if this is new news to you, you need to go and pick up a copy of No Grain, No Pain from your library, or you can pick it up at Amazon if you want to own your own copy. But this is my book. I wrote this book years ago. This is the diet plan to reduce chronic inflammation. And again, this type of diet has tremendous impact on folks that have chronic skin inflammation and even other forms of inflammation, chronic joint inflammation, chronic nerve inflammation, chronic inflammation systemically in the body. So take advantage of that book and that diet if that's new to you. And in the meantime, consider asking your doctor about histidine and supplementing with it.